The Maltese vegan. As you probably know by now, we're in the month of Pink October, the month dedicated to breast cancer. Here in Malta, and probably in most of the world, there have been a number of events and ads to raise funds for breast cancer research and to raise awareness of breast cancer. I know it's late in the month, but I finally decided to make this video, to do my bit. However, my message is not like the ones that have been spread this month. In fact, it's more of a criticism, but also with lots of advice. So, a bit of a disclaimer here. I'm not attacking people with cancer, God no. Nothing further from the truth. In fact, this is to help people suffering from breast or any type of cancer. I'm not attacking the intentions of the campaign. In fact, I hope more and more of effort is done each year. I'm not attacking the marketing agency, since they did a good job of presenting the information they had at their disposal. In fact, that is precisely where the issue lies. The right information is ignored, not by them, but by the health industry. The health industry hides what can best solve the issue of cancer. The main strategy, in fact, is on early detection, since it's presented as the best way of being able to cure your cancer because it's caught at an early stage. Ironically, you will see that it's neither early nor is it cured. So while mammograms may be an important weapon in our fight against cancer, the campaign alienates potential, actual and surviving breast cancer patients from the most effective, cheapest and safest and all-in-one cancer preventing and cancer curing strategy. The campaign is at best well-intentioned but misguided. Dr. McDougall says it best.
I believe that diet causes breast cancer, the rich Western diet full of fat, cholesterol, and chemicals, and I believe a change in diet will make a huge difference as far as the outcome of various cancers, not just breast, but also prostate and colon cancer. After all, it makes sense to stop throwing gasoline on a fire. But do you ever hear this from your doctor? I don't think so. You go to see your general doctor or the surgeon or the oncologist, and you ask, what should be done with my condition of breast, prostate, or colon cancer? And the answer is surgery, radiation, chemotherapy. But doctor, what caused this? Well, we don't know. Yeah, we do know. We do know that these are caused by the strongest contact we have with our environment, which is the food. Yeah, every day we take in 1 to 5 pounds of food, and that makes a difference. So when you see cancer varying in different populations of people that eat differently, the conclusion should be immediately, well, it's the strongest contact with the environment, it's the food. So you see people living in Asia who live on rice and vegetables, very little meat, almost no dairy, and they have very little colon, breast, and prostate cancer. It's the food.
Women who averaged at least a certain daily serving size of mushrooms appeared to drop their odds of getting breast cancer 64%. What was that average serving size? A half a mushroom a day. And if you combine mushrooms with green tea, sipping a half a tea bag worth of green tea every day along with that half a mushroom was associated with nearly a 90% drop in breast cancer odds. Breast cancer is initially so slow growing that women may have tumors years or even decades before they're diagnosed. So it makes sense that the same dietary factors that help grow the tumor in the first place would keep goading it on before and after diagnosis. But in general, the same diet that helps prevent breast cancer appears to be the same type of diet that's going to help prolong survival. That seemed to be the case in this recent New York study. Started out with about 1,000 women with breast cancer, ended up with less than 1,000. Must be so sad to do these survival studies. You never know who's going to make it to the end. Several investigations have suggested that plant-based diets, rich in fruits, vegetables, and grains, as well as their related nutrients, may have a beneficial effect on survival after breast cancer. Evidence pointed to lignans, phytonutrients found throughout the plant kingdom. We know they may prevent breast cancer. Now we know dietary lignan intake is associated with improved survival among postmenopausal women with breast cancer. In fact, it appeared to cut mortality risk in half. Where do you find it? Well, there's some in red wine, whole grains, vegetables like kale, big jump to sesame seeds, and then meteoric rise to flax seeds. Let me squish down the scale here. Look at that. Nothing comes close to flax. So you add just a teaspoon to your diet, and you may have just doubled your entire intake for the day. A recent editorial in the Journal of the American Association for Cancer Research starts out, "There are far too many breast cancer survivors," by which she means it's great that women with breast cancer are living longer, but lamenting the fact that the number of women getting breast cancer in the first place isn't going down. 1 million women every year. As with any other epidemic, identification and aggressive reduction of any reversible risk factors must become an immediate priority. One such risk factor appears to be inadequate fiber consumption. For example, this new study out of Yale, among premenopausal women, higher intake of soluble fiber was associated with a significantly reduced risk of breast cancer, 62% lower odds. And when they just looked at younger women with the hardest to treat breast cancer, the estrogen receptor negative tumors, then those eating the most fiber appeared to have 85% lower odds of breast cancer. Plant foods, the only natural place fiber is found. The reason it's important to understand how they arrived at their conclusion is that maybe it's not the fiber at all that what's so protective. The reduced risk of breast cancer associated with dietary fiber intake observed in this study may in fact indirectly reflect the effects from some other dietary nutrients, and thus dietary fiber here may simply act as a marker for other exposures which have been linked to reduced risk of human cancer as well, such as folate, phytochemicals, carotenoids, vitamin C and E, which are also like dietary fiber found in plant foods, such as vegetables, fruits, and pulses, legumes, beans, peas, lentils, soy, as well as in grains. And look, if you're eating more plants, you may be eating fewer animals. An increased consumption of fiber from foods of plant origin, such as vegetables, fruits, and grains, may reflect a reduced consumption of foods of animal origin. In fact, every 10 grams a day increment in dietary fiber intake was associated with a significant 7% reduction in breast cancer risk. For the first time, though, they showed a potentially nonlinear response, meaning the more fiber you eat, the more benefit you appear to get. American women average about 15 grams of fiber a day, only half the minimum daily recommendation. Maybe that's why vegetarian women may have lower breast cancer rates. Right? More plant foods equals more fiber. Vegetarians only seem to be averaging about 20 grams a day, though. Better, but still not even making the minimum. So one might really have to venture out into vegan territory. Off the chart averaging 47 grams a day, or if a really healthy vegan diet, 59 grams of fiber a day, or eating lots and lots of vegan Thai food, 68.7.
Huwa ħafna importanti illi tagħmlu s-self-examination biex tkunu tafu lilkom infuskom it-trattament jaħdem aktar meta intom il-kanser issibuh meta jkun żgħir. Il-parir tiegħi hu li tmorru tagħmlu iċ-check-ups.
By the time it's picked up, it may have already been growing, maturing, scheming for years, acquiring hundreds of new survival of the fittest mutations to grow even quicker, better undermine our immune system. So-called early detection, like mammogram, is really, really late detection. People are considered healthy until they show symptoms, but if we've been harboring a malignancy for 20 years, we may feel all right, but we haven't been. So many people who do the right thing and improve their diet in hopes of preventing cancer may very well at that very moment be treating it as well. Cancer prevention and treatment may sometimes be the same thing. What do you think they found? Although broccoli consumption appeared especially protective in premenopausal women, for women of all ages, winner number one was collards. No surprise, it's cruciferous, it's a dark green leafy, it's like kale. What's not to like? So, but winner number two was a shocker, carrots, which Tracy featured on the cover of her great book, along with collards. As one researcher suggested, a whole food vegan diet, rich in fruits and vegetables, especially if coupled with regular exercise and smoking avoidance, could be expected to have a remarkably positive effect on African American cancer risk, reversing the increases in cancer risk incurred during the 20th century.
Yeah, it's the food you use to prevent it, and the food will make a huge difference even after you get these kinds of common cancers. I don't mean you'll just live better, trimmer, more active, feeling better. I mean you'll live longer. Yes, that's what the research says, and that's what I believe, and that is you can change the course of major organ cancers by changing your diet. It only makes sense. You want to stop feeding these tumors.
Give me a thumbs up if you like this video, and click the subscribe button below if you want to keep watching my videos.